New York City is in the grip of the coronavirus crisis. The Big Apple is unrecognisable. It's almost a ghost town, with authorities enforcing lockdowns and self-isolation. 9 News North American correspondent Alexis Daish is there.
Well, this is what life now looks like in New York. The Big Apple is usually a buzz of activity, no matter the time of day, and not anymore. We are right now on 5th Avenue. We're just around the corner from Rockefeller Plaza, and it was these sorts of really popular and very famous parts of New York that presented the biggest challenge for authorities who were trying to enforce these social distancing guidelines. But look at it. New Yorkers and tourists alike have clearly got the message loud and clear. We've been on the ground covering this pandemic here, which is the epicenter of the crisis here in the US, and day by day numbers on the streets have dwindled to what you're now seeing. And guess what? It's working. The Governor of New York State made a key point the other day, which in my opinion is significant, but it got lost in the plethora of information and statistics that's currently out there. And it relates to density control. Now, obviously, New York has an incredibly high population density compared to other parts of the US, which makes the spread of this disease far more insidious. So, authorities here have been working hard at reducing density. That's physical distancing, mandating that all workers for non-essential businesses stay home, closing schools, all those sorts of things. And they've now released evidence that shows over a period of just 3 days, the hospitalisation rates slowed significantly. The number of hospitalisations was doubling every 2 days, but decreased to doubling every 5 days. Now that is great news. The evidence shows social distancing is working. And bear in mind, this didn't just happen overnight. This took weeks of New Yorkers hearing the message and acting on the advice. And it shows communities, no matter where you live in the world right now, need to be committed to combating this pandemic, because it takes time to see the positive effects of that change in behaviour. Having said that, the road ahead for this city and this state is a long one. They have a disproportionately huge number of Americans infected with COVID-19, and the worst is yet to come. As the Governor has revealed, it's predicted New York State won't see the peak of this pandemic for another 2 to 3 weeks. Now, for that reason, there are other parts of this country, and Australia for that matter, who should be looking at New York, looking at what it's doing and emulating the same action while they're at an earlier stage of this crisis, because that's how you get on top of it, by getting ahead of it. And that is something the Corona Task Force doctor at the White House, Dr. Fauci, has reiterated time and time again. Wherever we think this virus is at, it's actually 10 steps ahead of there. And I asked Governor Cuomo what Australia should be doing to get on top of this. Here's what happened. Australia is only just facing the lockdowns, cafes closing, restaurants closing. So we're a bit behind the US and New York State specifically. With what you're now seeing, what would your advice be to Australians about how serious this is and what they should be doing?
It is as serious as a matter of life and death. My advice would be act sooner and act more dramatically. There'll be some people who say this is media hype. They are wrong. They are wrong.
Now, in a nutshell, there are 2 massive challenges to overcome as this crisis reaches its worst point. Firstly, the health system. It's essentially in a race against time to be prepared for this. And we've seen New York getting ready with the military moving in, setting up field hospitals, setting up tents outside Bellevue Hospital in Manhattan. And that also involves tracking down medical supplies, because it's no use having extra beds if you don't have extra ventilators. So that's the mission for authorities, sourcing the extra equipment for the inundation of patients. The second challenge is the one that we are all responsible for and we are all capable of helping with, and that is slowing the spread. And that is where New York has seen a degree of good news with those slower hospitalisation rates due to lowering density. It's pretty simple. Stay home and stay away from people. And if you have to go out, make sure that you stay 1.8 metres away from anyone at any given time. It might feel bizarre when you're walking down the street and you feel like you're darting around people, but here in New York, that's what I've really noticed. People are very conscious about how they move now in public spaces. A doctor in New Jersey has predicted that 1 in 3 pedestrians walking down the street has got COVID-19 and is asymptomatic, so they may unknowingly be transmitting this disease. Now, another measure New York is looking at is trialling the closure of streets like this one to traffic, so closing it off to cars, meaning that it is purely for pedestrians. What that means is that New Yorkers can walk from A to B with more space to move between each other. It's just another thing this city is doing to lower density. It's an easy change to make, and guess what? New Yorkers are actually listening to that advice and acting on it. And these are the sorts of things Australians must do if we are going to have any chance of getting on top of this pandemic back home.